Nigeria, approximately only 43% of people have access to quality primary healthcare services. That's less than half the population of more than 200 million. Well, to address this, the Federal Ministry of Health will host the Primary Healthcare Summit, where it will launch a historic program to transform the under-resourced primary healthcare system in the country. The summit will bring together top government officials and leading private sector executives to present plans to revamp the healthcare sector by 2030. Well, for more on these transformational plans from the Ministry of Health, in collaboration with the National Primary Healthcare Development Agency, we're now being joined by the agency's Chief Medical Officer, Dr. Oritseweyimi Ogbe. I hope I did not murder that name.
You actually did very well.
I'm so sorry.
Fantastic.
Yes. So pronounce it now.
Oritseweyimi Ogbe.
Oritseweyimi Ogbe. Thank you so much. And I do apologize once again. So let's talk about primary health care in Nigeria. This is very important. When you talk about healthcare in Nigeria, the pyramid, inverted pyramid, and the stress we place on the secondary instead of the primary. So how do you repurpose the PHCs in Nigeria with the current abysmal doctor-to-patient ratio? And even at that, the doctors are definitely, likely going to go on a strike on a national, on a yearly basis. It's a lot of work. So how do you plan to do this?
So I think we just need to appreciate the fact that primary health care is like the bedrock of the national health system. The policy says that is the foundation of it all and the pillar that holds it all up. And it can actually address, when functioning optimally, up to 70% of the issues we have day to day. It's because of the poor performance at that level that people do not get access to care readily. Then they get more ill and then have to go to the upper levels of care. And because of a loss of confidence over time, because of some intrinsic things that have been antagonizing primary health care, key among this is just the dread of human resources at that level. So it's a challenge to mobilize them, to engage them, and to retain them. And this is linked to the suboptimal financing of primary health care. Most times because politically buildings are more visible, there's more focus on tertiary and secondary care as part of achievements. So you see a lot of those kind of structures going up in states and very little attention being paid to the primary health care. Some states do pay a lot of attention, but it's not enough to make them function optimally.
So what exactly will make primary health care function optimally? I mean, 600 pediatricians to 40 million children. Amazing. Yeah. What exactly are the specific areas of transformation of the primary health care? So
the transformation is based on a 4-point agenda of the Honorable Minister of Health. Key amongst this is the first point, which is really to revitalize primary health care. And to do this, the first thing we need to address is make sure that the human resources are available. And luckily for the primary health care level, we don't need all the very high-skilled persons available. What we want are basically what we call skilled attendants at beds. These are actually midwives or other cadres of health workers that have been trained through WHO protocol to actually be able to attend to women during birth. And so once we have that in place, the next thing is to be sure that they have the right equipment and essential medicines. There's a clear logistics system to ensure that essential medicines are available at the primary care level for Nigerians. And of course, to deliver this, there must be a conducive environment. So we de-emphasize infrastructure because often people think that's what the problem is. But it's just the fact that, for instance, we're here in this beautiful studio broadcasting. If we're outside, it will be convenient to give the broadcast. But because you have the right infrastructure, you can perform better. So that's just the way, that's just the need for infrastructure in primary health care. So in terms of the need, it's really the biggest gap is the human resource, both in terms of the challenges and in terms of the financial requirements to address it.
Now we understand why there's a need for a summit. But tell us about your summit. What do you hope to achieve with it?
So the summit is just the start. Often when most events happen, it's like the end. Oh, there was a summit, there was a report, and nobody hears anything. But the idea of this summit is to galvanize the whole stakeholders, particularly national and the private sector, which we often tend to overlook and ignore, and international stakeholders, our partners that have been working with us and global donors, to actually converge, agree on the 4-point agenda of the Honorable Minister, escalate it, and raise the required resources to revitalize primary health care. So this is what will be happening on Thursday and Friday this week, and we're expecting stakeholders both internationally and nationally, even from the presidency and ministers across board, to really come together. We've been engaging them, and there's a lot of alignment, and we hope that the summit itself will be like a kickstart for the progress. So most of the plans are really going to start being implemented after the summit.
All right, Dr. Oritseweyimi Ogbe, thank you very much for joining us. We
It's
do
my
hope
pleasure.
That, we'll give you all the very best, of course.
Thank you so much.